Hello there, it's Linda here from Just for Tummies. Did you know that this October 2024, is the world's first Diverticular Disease Awareness Month? And it's about time too, in my opinion. So throughout the month of October at Just for Tummies, we are going to be dedicating it to diverticular disease and diverticulitis. So the majority of our newsletters and social posts this month will be about diverticular disease and how to prevent those awful debilitating diverticulitis flare-ups that very often mean you have to take antibiotics. In some serious cases, people have to be admitted to hospital for IV antibiotics, for surgery to remove diseased parts of their bowel due to the diverticular disease, and also, of course, admitted to hospital if sepsis is suspected as a result of a diverticulitis attack. So diverticular disease, just to give you a little bit of information, it's very common. It's a very common and should be a relatively benign disease that can affect the whole length of the gastro-intestinal tract from your mouth to your bum, your rectum. So you can get diverticular pocketing, the pockets, the herniations that can develop in the gastrointestinal tract. They can develop anywhere in the gastrointestinal tract, in your esophagus, in your stomach, in your small intestine, but invariably the herniations appear in the large intestine, and more often than not on the left-hand side, in the sigmoid, the descending bowel, and the rectal parts of the bowel on the left-hand side. And symptoms are pain, cramping type pain. Sometimes you may see blood in your stool, a high temperature, loss of appetite, and just a feeling of not being well at all. And any of those symptoms, need checking out by a GP. Some people say it feels like a stitch low down in the left-hand side. But with proper bowel hygiene and bowel management, diverticulitis attacks can be prevented. And here at Just for Tummies, I've written a diverticular disease fact sheet. You can read about it if you click on the link below this video. And I've put together a specific protocol to help reduce those diverticulitis attacks. Very often people don't even know if they've got diverticular disease until they perhaps go into hospital for a colonoscopy for some completely unrelated issue, and the endoscopist or the gastroenterologist just happens to say, oh, you've got some diverticular disease, and you probably never even knew about it. And when it comes to diverticular disease, the herniated pockets, you may just have a few, and they may be quite small and they may be quite shallow, or you may have a lot scattered around the whole length of your large bowel, and some of them may be large and some of them may be deep. And the deep ones are the ones that can be prone to causing the bowel to rupture, and of course that can increase the risk of sepsis. But the majority of us, I'm 64, so I would imagine I've got some diverticular pocketing in my bowels, although I've never been diagnosed, and I don't get any gut problems at all. But then I do take my Just for Tummies supplements. But some people, as I say, are plagued with these diverticulitis attacks, and supplements like charcoal, activated charcoal capsules. I often recommend our 5-day charcoal cleanse, and again I'll put a link to the charcoal cleanse fact sheet in the below this video. And then I recommend taking the supplements in our 30-day perfect balance kit. But if you're not sure what to do, what to take, where to start with trying to better manage your diverticular disease and your diverticulitis, just reply to this email and either myself or one of my team will help support you and get you onto a diet and supplement program that can help prevent those awful flare-ups. So I do hope you enjoy our newsletters this month, this first Diverticular Disease Awareness Month. And again, if you've got any hints, any tips on how you manage your diverticular disease and stop the diverticulitis flare-ups, I would absolutely love to hear from you so that I can share them with other people. Thank you so much for listening, and bye-bye for now.